All right, hello everyone. This is Whitney Eichstead. I'm going to get started now that it's 10:25. I just want to take a second and thank everyone for joining my session, and I hope you enjoy my presentation. So today I'm going to be talking about inflammation and chronic diseases. So I chose this topic mainly because, it's such a vital thing for I think a lot of us, for nutrition professionals and just for everyone's health in general. So I found it very interesting. I thought it would just be a very well-rounded thing to look into. All right, so just to get started, kind of just some things I'm going to be going through today. I'm going to run through kind of a general definition of what inflammation is, kind of the differences between what acute versus chronic inflammation is, kind of the big how promotion of disease is caused by inflammation. And then I have 3 studies that I'm going to run through on type 2 diabetes, cancer, and obesity and their association with inflammation. And then a little bit about food sources, kind of my general main takeaways from my research, my opinion on everything, and then kind of closing it out with a summary on some points that everyone can take home with. All right, so what is inflammation? So essentially, it's basically our immune system's first response to whether it be infection, injury, or irritation. So it's really the body kind of reacting to everything coming in and responding to that. And then the diseases that usually result from inflammation, there's a lot of them, but kind of a few of them that I decided to pick out are cancer, diabetes, cardiovascular disease, Alzheimer's and Parkinson's disease, and then non-alcoholic fatty liver disease. So as I said, there's many others, but these are just kind of some of the main diseases that can. All right, so the difference between acute versus chronic. So acute is essentially the initial response, like I said, to a pathogen or a damage-associated molecular patterns. So this basically means it's kind of the natural response that our body already has. And this isn't necessarily a problem, but it more so becomes a problem when it turns into chronic inflammation. And so this can either be from the persistence of the harmful source, or it's an exaggerated inflammatory response, or it may be just an impaired resolution program. So basically, there's a very close relationship between inflammation and our immune system. So chronic inflammation really is the result of the prolonged white blood cells that get released from our immune system, and as a result, they start to attack the nearby healthy tissues. And this really means that the immune system is constantly fighting itself in our body, resulting in the chronic inflammation. So how does inflammation promote disease? So there's many things, but I kind of pointed out just a couple here. So to start out, there's the inflammasomes, which are basically the innate immune system's receptors and sensors. And when these get damaged, these are going to be a driving factor to a lot of age-related disease progression. So inflammation naturally increases with age, but when these get damaged, it's really going to kind of drive these age-related diseases to progress a little bit sooner than they may have before. And then we have the senescent cells, which is essentially our skin and adipose tissues. These are a complex stress response that mediates tissue repair and remodeling. We have the microbiota, and when this gets damaged in our gut, this is essentially going to affect cancer progression and treatment efficacy. So this means that, it might allow or block our body's anti-tumor immune response. So keeping this healthy is very essential. Also, we have the activation of the microglia. This plays a vital role in the etiology and progression of age-related neurodegenerative diseases. So as I mentioned before, this is really kind of about Alzheimer's or Parkinson's disease that can result from the inflammation. And then we also have the localized infection. So this is going to be that infection is in one area, and as a result, this is going to lead to a dysymbiotic relationship with another area. All right, so my first study is focused on inflammation and diabetes. And to give kind of just a background before I jump into the study, as a lot of us know, there's a very close relationship with inflammation and the development of type 2 diabetes. So with the pathogenesis of insulin resistance, which is a main cause of type 2 diabetes and the related complications, and with a high glucose level, this is really going to promote a lot of in inflammation. So for example, there's the pro-inflammatory cytokine release. It's also going to elevate surface protein expression of toll-like receptors. It'll also promote pro-inflammatory signaling pathways, as well as causing the release of pro-inflammatory microparticles in monocytes and macrophages. So essentially, this shows that the high glucose levels is going to trigger the activation of our immune cells, which also drives the cycle of inflammation and insulin release in type 2 diabetes. So my first study was called The Effect of a Short-Term Low-Carbohydrate, High-Fat Diet with or Without Post-Meal Walks on Glycemic Control and Inflammation in Type 2 Diabetes. So as I have on the slide, it was a randomized controlled trial. Unfortunately, it only had 16 participants, 8 men and 8 women. They were aged between 48 and 72. So the participants, this was a low number, mainly because it was made to be a pilot trial to kind of promote future studies to occur. So some of the inclusion criteria included individuals with physician-diagnosed type 2 diabetes, an HA1C greater than 6.5%, fasting plasma glucose is greater than 70 millimoles per liter, which is actually pretty low, I would say, for being a criteria. And then also a 2-hour oral glucose tolerance test of greater than 11.1 millimoles per liter. And criteria individuals involved, they couldn't be in already a regular exercise routine, which basically meant greater than 3 days of structured exercise per week. They couldn't have been already following a low-carb, high-fat diet, and they couldn't be unwilling to consume the provided meat-containing diets that were going to be given to them during the study, and they couldn't be on insulin or already have a diagnosis of any cardiovascular, kidney, or diabetic complications. So the overall purpose of this study was really to determine whether reducing hyperglycemia with a low-carb, high-fat diet was going to lower markers of innate immune cell activation and systematic inflammation in people with type 2 diabetes. So what they mainly did with the method of intervention is they had 3 short-term, 4 days controlled intervention periods. So all participants went through all of these intervention periods to kind of truly see the effects from all the interventions. So this included following a low-fat, low glycemic index diet. So this is basically what we as nutrition professionals usually recommend for people with diabetes. And then for the next group was the low-carb, high-fat diet, meaning that it had the same energy content as the first group, but it was having 65% of the overall calories was from fat. And then for the third group, it was the low carb, basically the same thing as the other group, but then they also added the 15-minute post-meal walk. They also used fasting blood samples to monitor the glucose amounts, and then all the participants wore step trackers to help monitor the results from the intervention and to make sure that they were following along with the different interventions, and basically to make sure that participants were actually doing what they wanted in the study. To help make sure that all the interventions were as effective as possible, there was a 9 to 14 day washout period. So basically, like it sounds like, they were able to give them some time for their bodies to adjust to the next one to see if the true effects of the interventions. All right, so I threw this in here just because I think it gives a good idea of what the diets actually looked like to them. So in this study, the participants received all of their food from the researchers. So as you can see on the far right side of the low carb, high fat diet with exercise, it kind of gives an example of what they had for breakfast, being the whole egg, some avocado, peppers. For lunch, they had kind of a mix of things as well. And you can kind of just glance through of the different things that they had during the day. And at the top, it shows kind of the breakdown of the percentage of the different macros. All right, so the results of this study, They did find that the low-carb, high-fat diet with or without the post-meal walks did improve the 4-day glycemic control compared to just the normal low-carb, low glycemic index diet. There was no consistent effects of the individual interventions on inflammatory markers, but overall, all 3 diets did show a lower PMBC, which is essentially the peripheral blood mononuclear cells, which is a marker of cellular inflammation over the short-term period of the study. So when the JNK here is phosphorylated, it basically is a signaling node that is key for controlling inflammation. And then we have down here the MCP1, which is an inflammatory marker, was the only cytokine to show a significant decrease over the 4-day interventions. So the limitations and the strengths of this study. So to start out, some of the limitations were definitely that there was some unintended weight loss in all of the intervention groups. And this mainly is due to that, like I said before, that their whole entire diet was completely changed from what they normally did eat. And then for the second, it being that the participants continued medications during the study. So, I mean, with a lot of them, they already did have diabetes, so obviously you're not going to take them off their medications, but from this, they weren't really able to tell if there was an interaction with their medications or not, but they did keep a medication log to know for sure what medications they were taking. And then for the third limitation is pretty much the overall length of the study. So as mentioned, this was only 3 separate interventions being 4 days long. So if you really think about it, that's a pretty short period of time to really know for sure the true effects of the interventions. And then the strengths, though, it did prove that a low-carb, high-fat diet with and without post-meal walks significantly and rapidly normalized glucose levels. So I do think this is a tricky study because, you know, the low-carb, high-fat thing is kind of a big thing right now. But I think it might be a good area for someone to maybe start if they do need to, as mentioned with the strength, rapidly normalize their blood glucose levels. All right, so on to my next study is focused on inflammation and breast cancer. And just to give some more background on this topic as well. So overall, I thought this was interesting during my study that breast cancer survivors are actually the largest number of cancer survivors out there. So as also with my research, weight is one of the primary interventions to reduce reoccurrence in cardiovascular disease and diabetes as a result of cancer. Eating an anti-inflammatory diet can also reduce the risk of comorbidities as a result of cancer as well. So that's why they wanted to focus on the study of kind of seeing what the interaction of an anti-inflammatory diet is with cancer reoccurrence. So the Mediterranean diet is a pretty popular anti-inflammatory diet out there, and this is shown to help lower inflammatory markers and lower mortality in cancer, type 2 diabetes, cardiovascular disease, and overall cognitive decline. They also wanted to focus on herbs and spices because these are found to contain polyphenols and other antioxidants. And these are going to be strong antagonists against tumorigenesis, carcinogen bioactivation, and inflammation. So this study was called Dietary Intervention Among Breast Cancer Survivors, Increased Adherence to a Mediterranean Style Anti-Inflammatory Diet Pattern. And it's basically the treatment for better breast health randomized controlled trial. So in this study, there were 125 breast cancer survivors, 60 of them being placed into the intervention group randomly, and then 65 into the control group. So to be included in this study, they had to have a BMI greater than or equal to 25, have an early stage of cancer between, I guess, just being diagnosed or stage 3. They had to be English speaking and completed treatment at least 2 months prior to the study enrollment. And then they couldn't be included if they have a BMI less than 25 or they had treatment less than 2 months prior to the start of enrollment and they had a diagnosis of stage 4 cancer. So the purpose of this study was really based on implementing education and culinary-based dietary intervention to increase adherence to a Mediterranean-style anti-inflammatory dietary pattern in breast cancer survivors, and this was by promoting consumption of these anti-inflammatory foods, herbs, and spices. So essentially, this was a 6-month intervention period, and they used monthly nutrition and cooking workshops. So they split the group into 5 different cohorts of 10 to 20 of the participants. And in the monthly nutrition meetings, it was based on didactic practices to really give them education on the interactions with the anti-inflammatory diet and preventing reoccurrence of breast cancer. So the cooking workshops was also interesting because they actually used different anti-inflammatory foods to really teach the participants how to eat these foods and good ways of how to make them, I guess, taste good. And they also used motivational interviewing phone calls. So with this, they use stage of change, which as we all know is very important to use for goal setting. And the participants were very active in having their own role in making their own goals for where they wanted to go, and they were able to change them as much as they wanted. And then there were individualized newsletters, and then for the control group, they only received monthly informational brochures, but they had no additional services provided to them, so none of the phone calls or going to the workshops. And then dietary intakes were collected via questionnaire and a 3-day food records at baseline and 6 months. So this I threw in here as well, similar to the last study, just to kind of show what the workshops focused on. You know, for the first one, they did show kind of the relationship between cancer, inflammation, and diet. And as you can see for the foods, they threw in some different anti-inflammatory spices and foods, and then they showed them how to make these recipes to bring home with them. All right, so the results, there was a very significant increase of adherence to the Mediterranean diet in the intervention group. 3 of the greatest improvements from the study were that they were consuming greater than or equal to 3 servings of fish or shellfish a week. They reduced red meat intake to less than 1 serving per day, and limiting consumption of commercial sweet and baked goods to less than 3 times per week. And overall consumption and use of herbs and spices also did significantly increase. So limitations and strengths of this study. So limitations intake were ultimately based on self-report from participants on these questionnaires, and from that, missing data was found in the food records, but you know, it did kind of rely on the participants being honest, I guess. There wasn't a biomarker used, and the length of the intervention study they did mention being that, you know, 6 months is a significant period of time, but maybe a little bit longer could have helped to see further results. But their true purpose of this was to just increase adherence to eating the Mediterranean diet. Some of the strengths, there was a moderate sample size with low attrition rates. They had a diverse sample size with over 50% Latinas, this being the first study that had that large of a percentage to study. And then they also focused on promoting a dietary pattern rather than just giving them a specific food group or nutrient to see the interactions. All right, so inflammation and obesity. As we know, poor diet is really one of the leading risk factors for premature death and disability in the United States, leading to metabolic syndrome, heart disease, and diabetes. Fruits and vegetables, with or without whole grains, can also have a significant impact on markers of metabolic syndrome. And metabolic benefits of fruits and vegetables, as well as whole grains, really do interact with the gut microbiota, meaning that they use short-chain fatty acid production to really make sure that we're having the best nutrient absorption in our gut as possible. These short-chain fatty acids are also signaling molecules for carbohydrate and lipid metabolism. So really having an increased short-chain fatty acid intake is really going to decrease the risk for cancer and obesity. So with this study, it was really focusing on the role of whole grains versus fruits and vegetables in reducing subclinical inflammation and promoting gastrointestinal health in individuals affected by overweight and obesity. So this was also a randomized control trial with 49 participants. Their BMI needed to be greater than 25, no diagnosed GI diseases, no antibiotic use for 3 months before the start of enrollment, and less than 1 hour per week of structured exercise, and to have already have a low intake of fruits and vegetables and whole grains. To exclude them from the study, their BMI needed to be, or I guess couldn't be less than 25. They already had a high intake of the fruits and vegetables or whole grains. They had a regular structured exercise or recent antibiotic use. Maybe they had other health reasons, or they had otherwise scheduling conflicts with the study. So the purpose of this was to determine the impact of increasing intake of either whole grains or fruits and vegetables on inflammatory markers and gut microbiota composition. So the participants were randomized into 3 different groups. It was either 3 servings per day of whole grains, 3 servings, or the control group was purely with refined grains, where they did give them the refined grains, and this was basically to keep in touch with them. So with this study, the treatment foods in these different intervention groups, it was pretty much implemented into their normal diet. So it was more of like a supplemental idea. And they did use diet diaries for all groups to kind of monitor how much they were eating. Stool and blood samples were collected at baseline and at 6 weeks. Inflammatory markers were measured, being the TNF alpha, interleukin-6, LBP, and hsCRP. And stool sample analysis did include short branched chain fatty acids and microbiota composition. So some of the results included a significant decrease in the LBP in the whole grain and the fruits and vegetables group, induce a significant change in the interleukin-6, which is an inflammatory marker. Same being with the whole grains, did show a significant decrease in the TNF alpha, which is also an inflammatory marker. So it really showed that there were individual changes seen in the microbiota composition, but overall differences between the treatment groups was not identified. And this can mainly just be because of the individual themselves, of the diet that they were eating, the fruits and vegetables that they were choosing. So it kind of was hard to tell, I guess, if there was a true change in the microbiota composition. All right, so some of the limitations and strengths included that subjects did not consume all the same foods. They were able to really choose what they wanted from the specific groups. Once again, in this study, they relied on diet diaries to monitor treatment compliance, and variety of foods in the study kind of was a lot to kind of focus on to see the true results. Some of the strengths, though, were that it did have a comparison of whole grains and fruits and vegetables as a focus of the study, and it showed the positive impact on that whole grains and fruits and vegetables have on metabolic health for those who normally had a low intake of those. All right, so just to kind of wrap it up here of, what is anti-inflammatory foods? So I did mention the Mediterranean diet, but there also are some specific food sources I did want to kind of just touch on. These being berries, fatty fish like salmon, cruciferous vegetables, whole grains, as I mentioned, peppers, green tea, extra virgin olive oil, grapes, mushrooms, avocado. And these are all really known as anti-inflammatory foods, mainly because they have a presence of the phytochemicals and antioxidants that fight inflammation. And then I have here of limiting added sugars, refined carbs, processed meats, and fried foods, because these are ultimately going to promote inflammation in our body. Some of the anti-inflammatory herbs and spices that can be used, just to touch on a couple. For example, garlic, it's going to limit effects of pro-inflammatory cytokines. Black pepper is known as antibacterial and antioxidant. And rosemary is also an antioxidant that will boost the immune system and improve blood circulation. All right, so my main takeaways from my study here really are that inflammation is a natural response in our body that it already does use for protection, but it's more so a problem when it becomes the chronic response. It has a very big connection to many chronic diseases, and there really is no one food to fix all. So I kind of mentioned this in other studies that, it's important to remember that you can't always just give someone one supplement that's going to automatically fix it all. It's really about maybe having a combination of the anti-inflammatory foods when cooking with herbs and spices that are really going to give the biggest benefits. And then for my fourth one, being that there's many areas for future research. So there were a lot of studies out there that I had to comb through to really, hone in on the three that I wanted to focus on today. But I think that's also a very promising point to this area, that it's always going to be present in our careers, and it's important to understand it so that we can tell our clients the best way to help them. All right, so my overall opinion, on this topic is that inflammation really is a very complex process in our bodies, but we do know that it has a direct relationship to chronic disease progression. Also, that nutrition interventions are really beneficial at all parts of disease progression, and food sources combined with herbs and spices really do work together to reach optimum benefits to fight inflammation in our bodies. All right, so my overall take-home message for everyone here, it's kind of important to remember that inflammation does increase with age, but research does show strong benefits to having a healthful diet filled with a variety of the fruits and vegetables, as well as cooking with herbs and spices. So as I kind of mentioned as well, there is a lot of research out there to comb through, but it is really an area of research that I think does kind of, promote more thinking and kind of digging into it of how it affects our own lives, but then also our clients. It's also important to remember that inflammation affects all systems of the body, and it's really not just about, just our heart or just our gut or anything. So it's really remembering that it can really affect our whole entire body, and keeping it in check is going to keep it at bay. And then for the fourth point, understanding the process of inflammation and how to educate target population can really result in long-term changes. And that was really seen in my second study with the workshops of, if you really sit down and kind of work with your clients about what an anti-inflammatory diet is and kind of how they can actually implement this into their everyday lives, is really going to show lasting changes for them, so that they understand, how to, be the healthiest that they can be. All right, any questions?
Great job, Whitney. Just a heads up, if anybody has questions, please put it in the chat or feel free to unmute yourself. But if not, we have like little less than 10 minutes before the next two presentations. And I will also send the chat or the link for the survey if everybody could fill that out as well. We'd be very grateful for your feedback. Thanks, guys.
All right. First study, both groups lost weight. Do you know if there was a difference in the amount of weight loss between? Good question, Michelle. I do believe for that study that I think for them within the couple of days, so it was a 4-day period for the intervention, that it was about 1 to 2 kilograms. So being that it was only 4 days, that is pretty significant of kind of within that short period of time, and that happened in all intervention groups. So I don't know if that answers your question fully. And I did also put my email in the chat box if anyone does want to email me if they have any future questions. I'd be happy to answer them. If not, I'll be on here for a little bit yet to answer some more questions.